A woman, 47 years old. First consultation on October 8, 2000. She had cough and chest pain for 1 month, accompanied by hemoptysis for half a month. The patient had been physically weak since childhood. Every year in spring and autumn she would develop cough, and during those periods she had coughed up blood many times. In the past 10 years the condition had been relatively stable. 1 month ago cough and chest pain began to appear again. Half a month ago hemoptysis appeared, occurring more than 10 times per day, with a small amount of dark purplish blood, sometimes blood streaked in the sputum. There was pain in the chest and back, and she had difficulty lying flat. Dry and bitter sensation in the mouth, irritability and insomnia, irregular heartbeat and a feeling of oppression in the chest, sweating of the upper body, low-grade fever, and slight aversion to cold. Poor appetite, not wanting to eat, pale complexion and emotional tension. The tongue was enlarged and red in color. The coating covering the tongue surface was thin and yellow. The pulse at the wrist was thin like a thread and slippery. The physician considered that phlegm and excessive heat had accumulated inside the body. The physician first prescribed chai xian tang, adding fritillaria bulb, chuanbei, gardenia fruit, shanji, and trichosanthes pollen, huafen. The doctor did not record the specific herb weights. These herbs were decocted in water to make a herbal decoction, and the patient drank the liquid. After taking the medicine for 3 days, the condition improved. Follow-up visit on the 12th. Symptoms such as sweating, aversion to cold, and low-grade fever had completely disappeared. Irritability, irregular heartbeat, and insomnia were greatly reduced. Appetite had also slightly improved. However, chest and back pain and hemoptysis had not changed. The physician considered that the symptoms of accumulated heat had been resolved, but blood stasis and phlegm had not yet been eliminated. The prescription was changed to shui fu jiu tang, adding trichosanthes peel, gualo pea, allium macrostemon bulb, shebai, and nodo ginseng root, sanqi. The doctor did not record the herb weights. The physician prescribed 3 days of medicine. After taking the medicine for 1 day, the amount of hemoptysis increased greatly, consisting mostly of dark purple blood clots. On the 2nd day, the amount of hemoptysis gradually decreased, and the chest and back pain was also reduced. After continuing the same prescription for another 3 days, the hemoptysis gradually stopped. Only slight chest and back pain remained. After continuing the medicine for more than 10 additional days, the chest pain completely disappeared. Note: chai xian tang and shui fu jiu tang are names of herbal formulas from the modern period.